Good day, global citizens. Welcome to another episode of Dr. Fajembola'S Opinion. Thank you for joining us through other episodes of Dr. Fajembola'S Opinion. I see your comments, I see your likes, and we need more feedback on what we are doing on this platform. Please join me to welcome Miss Azugo Nwadiuto Okwuniru.
Yes.
I hope I pronounce your name right.
It's Azugo Nwadiuto Okwuniru.
I got it right. By the way, I so much love traditional names, and I'm so happy I'll be calling you Miss Azugo. She insisted I should call her Miss Azugo. She's a doctoral student, but let's keep it on Miss Azugo. So, Miss Azugo, welcome to this platform, and today we'll be looking at schistosomiasis, and I'm so glad on how we'll take the discussion through schistosomiasis. But before we dive into discussion, let's give our audience an overview of our guest researcher's profile. Nwadiuto Okwuniru Azugo, Miss, is a public health parasitologist, researcher, and science communicator committed to advancing equitable access to health education and care in rural Nigerian communities. She is currently pursuing a PhD in environmental parasitology and public health at the University of Port Harcourt, focusing on urogenital and female genital schistosomiasis among adolescent girls in underserved areas. Her advocacy centers on reducing gender and educational disparities in disease prevention. She has provided health education for out-of-school children in Anambra State, empowering them with knowledge about schistosomiasis and hygiene practices. She also founded the first schistosomiasis health club at Christ the King Seminary School, Nnobi, where she leads school-based advocacy and behaviour-change campaigns on NTD prevention and genital health. A fellow of Women in Global Health Nigeria and the Social Innovation in Health Initiative. Nwadiuto, Miss, combines scientific research with storytelling and community engagement to promote inclusion and health equity. When she's not working, you can find her nose buried in a good book, researching Igbo traditional cosmology or watching K-dramas. That's a beautiful profile. Actually, the K-drama, it made it interesting. I feel most Nigerian women are fans of K-drama. I don't know last time I watched K-drama. Maybe because my life.
It's a good stress reliever.
When you sent me, I used to watch K-dramas in medical school, by the way. When you sent me a profile, I was like, K-dramas? From last time I watched K-dramas, oh my God, I need excitement in my life.
I'll put you in some good ones.
My only excitement is social media.
I get that.
When I watch videos, I'm like, God, I beg. I'm thinking of the next thing to do as I'm watching the video, like, okay, thank you so much for coming on this platform. Thank you so much for honoring us with your time and honoring us, accepting to share your expertise with us, Dr. Nwadiuto. I'll be changing you anyway. As I say, I love traditional names. So you see, I've moved to Nwadiuto. Yes. So let's see what is being discussed about schistosomiasis, not just in Nigeria, but even outside Nigeria. The first is from ACE Bioinformatics and Data, where they said congratulations to the Watanos best team at the AF contest UG 2025. Their project targeting saccharine enzymes for transmission blocking schistosomiasis control aims to block juvenile worms and tackle growing resistance, a potential breakthrough in schistosomiasis control. The second is from Unlimited Health, where they said this year, together with our partners, we deliver 30 million treatments to people affected by parasitic disease. Watch the video for more highlights of our work to end schistosomiasis and soil-transmitted helminthiasis. The last is from Ferdinand, where he said, waking up with a snail on your face and constant schistosomiasis doesn't sound fun. it's a person is was reacting to it with. This time I didn't get from people because most of the tweets I got on X, they are just on organizations. And I feel with platforms like this, there will be more discussions on schistosomiasis.
Yes.
Actually, personally, the last time I discussed schistosomiasis was when I was in medical school. So when I saw this topic, I was like, okay, we are bringing schistosomiasis on board again. So Miss Azugo, we know what schistosomiasis is, and we are going to get more knowledge as we go on with this discussion. From the paper, I derived like schistosomiasis is a neglected gynecological manifestation, and it's true because it's not very well highlighted among what are they calling us NTDs. Yeah. Why is female specifically? Why is female genital schistosomiasis a neglected gynecological condition manifestation?
Okay, thank you very much once again for helping me to come into this, for inviting me to this platform. I'd say I watched a lot of your videos and it's amazing, and I want to commend the good work you're doing in terms of putting out research works out there with alternative means of communication to get to the wider public, especially those who are not in the academia. So thank you very much again. I wanted to thank you for using your platform to shed light on, research works and research papers and give them alternative means of communication to the wider public. So thank you for inviting me to this platform. Now, speaking of female genital schistosomiasis as a gynecological manifestation, female genital schistosomiasis is caused by schistosomiasis. Really, schistosomiasis is a neglected tropical disease. And neglected tropical diseases are they are infectious diseases of poverty. There are about 20 diseases lumped under this umbrella of neglected tropical diseases, including leprosy, snake bite and venoming, parasitic diseases like filariasis, river blindness, soil-transmitted helminthiasis, schistosomiasis, bulimic ulcer, and so on and so forth. There are over 20 of them, about 19 to 20 of them. And all of them are lumped under this umbrella of neglected tropical disease. So this already is in itself a disadvantage or a problem, so to speak, as to why this disease is neglected. Now, schistosomiasis is further divided into intestinal and urogenital schistosomiasis, which is because of the different types of parasites. The schistosome parasites themselves are different types, and some prefer, because as one of my lecturers would say, they take the human body as a landscape, and so everyone has a perfect or suitable portion of land or real estate in the body that they prefer to engage with. And so there are some of these parasites that prefer the intestines, and there are some others that prefer the urogenital region. And of course, when we come to genitals, we have two sexes, two genital organs. Either you have the male or the female genitals. And so we have both the male genital schistosomiasis and the female genital schistosomiasis. But you see, specifically with female genital schistosomiasis, its gynecological manifestations can be mistaken for common gynecological conditions. It has manifestations such as scarrings, known as rubbery papules in the cervix, right? And so they can be mistaken for, say, for instance, the strawberry symptoms of the strawberry-like cervix of Trichomonas vaginalis, for instance. And so all these issues compound as to why it is not necessarily widely recognized. Again, and perhaps most importantly, because one of the problems that we have with neglected tropical diseases in general is the cultural aspects and the behavioral aspects of the disease. It's not just because it's a disease of poverty, which already gives it an economic issue. There is an underlying economic issue, but also it has a lot to do with people's behavior towards their health, people's behavior and attribution and attitude towards health. So certain cultural practices perceptions and attitudes towards health also has an effect on why female genital schistosomiasis is not entirely being recognized as a gynecological condition. Say, for instance, some of our cultures, communications or conversations around genital health is a taboo. Even among children or adolescents or even adults, it's a cultural taboo to talk about certain genital health issues. And so because of it, all these factors really contribute to the neglect of female genital schistosomiasis. I mean, you mentioned something about the last time you talked about schistosomiasis or learned about schistosomiasis as a medical practitioner was back in medical school. And I'm sure that conversations around FGS was not necessarily mentioned in the textbooks because we have a study to prove this. I think it was a 2021 study on of paramedicals and medical students and teachers and professionals in Anambra State. And we found out that many of them, yes, knew about schistosomiasis, but the knowledge about female genital schistosomiasis was relatively not there. So all these issues, the medical landscape, the educational system per se, and the socioeconomic and cultural neglect of these diseases as neglected tropical diseases makes female genital schistosomiasis even more neglected than other neglected tropical diseases.
Okay, thank you so much for elaborating on that, Dr. Azugo. Miss Azugo, you told me that Dr. Yusris. I will try to remember. Thank you so much, Azugo. From the paper in Nigeria, UGS, which is urogenital cystosomiasis. I'm saying UGS so our audience will know urogenital cystosomiasis. Yes. Is endemic across all 36 states with approximately 101 million people at risk, primary school age children, adolescents. Okay. The public health of UGS in Anambra State. Can we paste it across other 36 states in Nigeria, and why? Because I know sometimes you can paste these public health pictures across the states and even cross country. So can you paste across other states in Nigeria?
I'd say no. No. It cannot necessarily be applied to all 36 states of the country for several reasons. One of them being that there are varying environmental conditions. There has to be the presence of freshwater bodies, like streams and ponds and rivers and lakes. There has to be the snail parasites, which is the intermediate host of the parasites. That means the host of the parasites in which the parasite has to reach a certain level of maturity before getting to sexual maturity. It has to be present. Again, socioeconomic conditions also contribute. You see, for instance, which is a very good example that I had to learn with State Nigeria, as at 2019, Rivers State was mapped out as one of the 8 most endemic states in Nigeria by a study from Azeezat et al. 2019. But currently, Rivers State is no longer endemic, or they have brought schistosomiasis to a certain level of control. And this is because of practices like water, sanitation, and hygiene, local health interventions, providing water sources in schools to prevent children and communities to prevent people from having contact with water bodies. And of course, like I mentioned, the environmental conditions. So it cannot necessarily be placed across all 36 states, particularly urogenital schistosomiasis. Maybe other forms of schistosomiasis like the intestinal, but particularly urogenital schistosomiasis cannot necessarily be placed across all 36 states. So no, I would say no, that it cannot be pasted across all 36 states. Just specific regions with suitable environmental conditions, suitable socioeconomic factors, lack of amenities, poor access routes, prone to flooding, even prone to conflicts. These areas, yes, are susceptible.
Okay, thank you so much for that, Ms. Azugo. our audience, especially Nigerian audience, can get a picture of what it takes to have schistosomiasis and the areas most affected by schistosomiasis. Moving forward, Ms. Azugo, why are school children and adolescents the main patients? Because from your discussion, I see that these are the main patients. Why are they the main patients?
Yes, so because they're often at higher risks. It's not just school children and adolescents, women and even adults, but particularly school children and adolescents are at a higher risk of infection because they have to constantly and frequently come in contact with freshwater bodies. I mean, go to our villages. Whenever you're passing through a village stream or something, it's always the kids. Are you there? Yes,
Yes, yes.
passing through a village or something, it's always the kids who are jumping into the water, playing and swimming, and so on and so forth. And well, I would say unfortunately, because when you now look at the current economic landscape of our country, some of these children are becoming breadwinners. So I'll give you an instance. In Anocha local government area, in one of the communities we went to, Adazin, which is not too far from my own hometown of Nnobi. One of the communities we went to, there is literally a stream just before the school, community secondary school, and you just watch as 2:30 bell, as the 2:33 o'clock bell rings, and these children dismiss from the school. A good amount of these young boys and girls head over to the stream where their mothers are probably vegetable sellers because there's a lucrative vegetable market close to that stream. They are removing school uniforms, diving into the water, washing clothes, washing vegetables, preparing for the next sale. Some of these young boys are the ones putting themselves through school. And so they are washing their keke, their tricycles, in the same river body, and some of them do not have access to water at home. So what do? Their domestic activities are all done in those water bodies. And so you see that these children are constantly being exposed, constantly at risk, because they actually do not have any other choice. If you don't go to the water to wash vegetables and help your mom sell food, sell the vegetables by the river's bank, how would you feed? How would you pay for the next exercise book you have to buy? If you don't wash your keke, where would you get the water from the media amount that you're using to, get passengers half a day? Because you have to go to school from, say, 8 o'clock to 2. So for the rest of the day, this is where would you have the time? So you have to understand that the situation, the socioeconomic situation that these children are being put into already puts them at risk. Let's remove the whole childhood exuberance of going to the water to bathe and swim and all that to play. I think even now it's less of that and more of it's a source of income for them. So because of it, these children and adolescents are at higher risk of infection.
Thank you so much for that. Ms. Azugo, please give us 3 things we should know about urogenital schistosomiasis. What are 3 main points you want our audience to take home as urogenital schistosomiasis?
Urogenital schistosomiasis is caused by a parasite. Excuse me. This parasite is known as Schistosoma hematobium, and it is transmitted by contact with freshwater bodies where the snails that carry this parasite. Then it affects people who are always in frequent contact with freshwater bodies. And finally, I would say that it causes long-term health issues like bladder and kidney infections, reproductive health problems. It has also been found to be the leading, one of the underlying causes of cervical cancer because of pre-exposure to HPV, that is the human papilloma virus, or even the HIV virus. To put it simply, I just want to paint a picture. Because, when we say things like this, it seems it's a predisposing factor. It's like big grammar, it's like big English. But let me paint a picture. Now, these parasites have terminally spined eggs, in that they have tiny eggs with very sharp needle-like spines, right? And so when the adult parasite is established, for instance, in the bladder, it creates a cocoon because it's both the male and female parasites. It creates a cocoon to protect itself. And this cocoon can lead to what is known as granulomas, sort of like raised lumps or big pusses in the bladder or in the kidney. So it increases infection. It increases it decreases the normal flow of urine. It can also lead to bladder or kidney cancer. Now, when these parasites mature, when the male and female mature and become sexually active, and they release these eggs, because the eggs have to continue the life cycle, they have to pass these eggs through the urine so that they can get to the outside environment and continue their life cycle. Now, as some of these eggs pass through the urine, because of their needle-like structure, they tend to pierce through the walls of the ureter and the urethra, pierce through the walls of these areas, and in so doing, they cause bleeding, they cause ulcers and wounds and lacerations. And so as you're passing out urine, it becomes painful, and there is a tendency that you will see blood in your urine. Now, sometimes because the urogenital tract is interconnected, sometimes it finds itself in the cervix of a woman. If it can cause this kind of damage in the ureter and the urethra, which have thicker muscles than the cervix, you can imagine the kind of damage it can cause at the cervix. It can lead to pulses known as rubbery papules, lacerations and wounds, even the same granulomas on the cervix of a woman. Now, if a young woman who is sexually active and already has these symptoms, already has these wounds and lacerations on her cervix, ends up having coitus with a man who is prone to HIV or even any STI, you will see that the infection rate is faster because she's an open wound. So this is why we talk about these issues often and on, or this is why I'm trying to bring upon exposure as to what female genital schistosomiasis or even urogenital schistosomiasis can cause. There are studies that show that it has become it's one of the, not leading, but underlying causes of ectopic pregnancies, of infertility, of cervical cancer, like I mentioned, of kidney and bladder infections and kidney cancer. And we have a culture of treating the symptoms as opposed to treating the underlying causes. So let us start looking at these underlying causes. Because if not, my people like to say I'm Igbo, and people like to say, if not, which basically means that what happens will continue to happen. The disease will continue to persist. These overarching issues will continue to exist, mostly because people are not aware of how to protect themselves or how to take care of themselves. So why we try to discuss issues like this is to just bring about awareness, so that the next time you're going to the river body, you become extra careful. When we talk about it being diseases of the poor, does not mean that it's only those women in the rural areas that are affected. I mean, some of us go back to the villages and we go for sightseeing. We visit the village water. Oh, hi, you step into the stream. You use it to wash your face because you're home. It's your home, right? It's part of the rituals that you have to carry out because you are home.
Yes.
And for some of our people, it's also the rivers, our culture, really. Rivers are so intertwined with our religious activities and beliefs, especially traditional religious activities and beliefs. And you cannot stop, still go to the river to pray to their gods and goddesses, or to, even if it's not to their traditional gods and goddesses, it's just a form of spiritual worship. They will still go there to do the things they want to do. They will still go there because they have no other source of income except from the river. My point is that awareness is important so that we can stop or break transmission. The more people know about this disease, the more they are eager to learn and to protect themselves. And the more we can be able to prevent or reduce or even totally eliminate it.
Thank you so much, Mr. Azugo, for that. Actually, you've talked extensively to our next question. I feel you've even answered our next question on the biological and sociocultural factors which predispose to urogenital schistosomiasis.
So, like I mentioned, some of the sociocultural factors, cultural practices, behavioral practices, like cultural practices like places of worship, behavioral practices like just going to the water to swim, to bathe, for sightseeing, just be in contact with nature, right? Domestic activities like washing of clothes, washing of vegetables, food items, water bodies and all that, all these. And even socioeconomic activities like fishing, rice farming, vegetable farming that's done along the river banks, all this can increase exposure. Yes, genetic and immune system differences can also influence infection, because there are people who have been exposed all their lives, but because they do not have heavy burdens of infections, they do not show even symptoms of schistosomiasis. But that does not mean that they are not prone to transmitting it. As long as the adult parasites are in your system, you continue to pass the eggs into your urine. And passing it in the urine means that with flooding and with the rains, they all wash down into our river bodies and the infection continues. So even one infected person, because infection is a homogeneous system, so even one infected person can affect an entire community, even if they do not show symptoms. Just the fact that the adult worms are in your system and so you are passing out the eggs, you are prone to infecting others, even if you do not show symptoms of infection. These are the issues. Yes, thank you.
Thanks so much, Ms. Azugo, for that. You mentioned snail repeatedly in the paper, and Nigerians are good consumers of snail. What relationship does snail have with UGS?
Okay, so the snails are the intermediate host for the Schistosomiasis parasites. Now, intermediate hosts are the hosts that sort of create a break in transmission, allowing the parasite to reach a certain level of maturity before they come into the humans, who are the definitive hosts. Now, in the humans, they reach sexual maturity. But in the snails, if the parasite just gets to the larval stage, for instance, and the larval stage is called the cercaria. Now, one of the common misconceptions, of which I do not want our people to stop consuming snails because of schistosomiasis, it is not transmitted by digestive system. It's not when you eat the snail that you get infected by the parasite. No. You see, the snails themselves are also victims of this parasite. And so when the snails are excreted, they go through a process called the shedding of the cercaria. It's actually a very beautiful thing when you get to observe it under the microscope or like in a natural system. The snails begin to shed the cercaria. It's like brushes coming out of them, right, in the water body, and they release the cercaria into the stream. Now, when you enter into the water without protective coverings like rubber boots, rain boots covering you up to your knees and ankles, which is, by the way, a suggestion that a student give. I'm going to come to that. But when you get into the water bodies without properly protecting yourself and you dip into the freshwater bodies, it's important to note that it's a freshwater body, not your seas or your oceans, but your rivers, your lakes, your ponds, not salt water, freshwater. So when you now get into the freshwater body, this larval stage that has been shed by the snail, as known as the cercaria, can now penetrate into your skin. and travel through the system, your blood system, and find themselves either at the intestine for the intestinal schistosomiasis, or for at the kidney and the bladder, consequently, for urogenital schistosomiasis. There they would grow and develop into adult worms, mate, and then proceed to shed the eggs. That is to lay their eggs, and these eggs are now what causes the infection itself. I hope I've been able to break it down properly.
Yes.
But to say
Yes.
that consuming the snails, no. The snails have to shed the cercaria into the stream. You have to come in contact with the stream for the cercaria to penetrate into your skin. I think some of us we get to feel it sometimes. Sometimes when you get into the water, when you visit your village stream, for instance, and you dip your feet into the water, by the time you come out, you start itching. You start itching, and they'll be like, "Oh, you're allergic to water." It's just allergy. It grows into bumps and scales, of which we are going to come to that when we discuss the clinical manifestations. But it's not always just allergy. It may be that the cercaria has penetrated and you felt the sensation that a foreign body has gotten into your system. So you itch, you scratch yourself, right? If even enabling it to move in faster, because you're removing certain layers of your dermal epithelial cells for it to move in faster. So that's how it is transmitted. Thank you.
Thank you so much for enlightening us, especially people who read this paper, which we encourage people to do, and they be like, "Oh, should we not eat snail anymore?" So thank you so much. That's why I want people to get from the author's perspective of what each publication is trying to relate to the public. Ms. Azugo, please can you paint for us a picture of the clinical manifestation of urogenital schistosomiasis?
Of course. So, one of the major symptoms of urogenital schistosomiasis is what we know as hematuria. That is blood in the urine. When you begin to pass blood in the urine, it is not a good thing, because a few of our cultures down here, especially communities along the riverine areas in Anambra State, have this belief. Sorry. We have this belief that passing blood in the urine, especially for men, shows that you have reached manhood. It's a cultural belief. And it's not just exclusive to Anambra State. So many areas of the country who hold this belief. So, but when you see blood in your urine, it's not necessarily a good thing. In fact, it is not even a good thing at all. So it's one of the first signs that there might be an infection with schistosoma hematobium. Again, of course, in passing blood in your urine, you will feel pain. So painful urination, lower abdominal pain, especially severe lower abdominal pain. In women, lower abdominal pain that has nothing to do with your ovulation or menstrual cycle can be a symptom of schistosomiasis. Then we look at cases of bladder or kidney damage. When you get, like I initially explained, that these adult worms tend to reside in the bladder and in the kidney, and your body will fight it. As your body is trying to fight it, they create a cocoon protecting themselves from your body using the tissues of your kidney and your bladder. This is known as the granuloma. It's kind of like a raised skin. Now imagine having a bump or a boil, but in your bladder, in your kidney. Do you get that kind of thing? So these are all the underlying issues. So when you begin to notice a problem with your urinary tract, certain kinds of pain, abdominal pain, lower abdominal pain, painful urination, blood in the urine, please do well to test yourself. Schistosomiasis tests are very easy. Just pass urine and give it to the lab technician, and they can look it, spin it and check for the parasites under the microscope and inform you if you have it or not. You can take the results to your practitioner, your medical practitioner, and begin treatment. The drug is free. Treatment is free. Your local health centers are supposed to have praziquantel for free and give it to you. The drug of choice is praziquantel and give it to you. It is part of the yearly deworming that our government does from communities to schools to churches to mosques to markets and all that. So please, whenever these things come across, certain misinformation in the health system has led to our people being so scared of taking mass drugs, mass vaccinations. But these things protect us. These things prevent us from having infections. And which is why I always advocate for education and awareness. So even if you wouldn't want to take those drugs that the government are giving for free, at least know the name of the drugs so that you can get it for yourself at the local pharmacy. Every 3 to 4 months, deworm yourselves, deworm your children. It's that simple. Especially if you are prone to exposing yourself to the water body. Again, and I cannot overemphasize this, it is an underlying cause for several reproductive health issues. Co-infections with HIV, co-infections with Trichomonas vaginalis, co-infections with HPV. In that study in Anocha, this beautiful 17-year-old girl who is not sexually active who is sexually active, but she's a beautiful 17-year-old girl in SS2, senior secondary class 3. Senior secondary, because there were several girls, but she showed the highest rate of infection. In senior secondary class 3, this beautiful girl, who is first daughter of a family, very resourceful, very hardworking, helps the parents, helps her mom in her vegetable business. But this beautiful girl had a co-infection with Trichomonas vaginalis. She showed signs of possible HPV infection, and that is what breaks my heart even more, and why I try to advocate even more, because things like this should be included into our sexual and reproductive health care packages. You see, with one test, with one cervical examination, say you're trying to get a pap smear for HPV, but with one cervical examination, you can test for FGS, test for HPV, also test for Trichomonas vaginalis, because in one cervical examination, we were able to find that this girl was exposed to all three. So why not include it? Why not create more awareness, more buzz around it and include it? Because, like it or not, it is an underlying factor. You may treat the HPV, you may treat the Trichomonas vaginalis, but as long as that girl continues to go to the water body, these infections will persist. The point is that if one cervical examination can, provide a bigger picture of what she was going through, why not include female genital schistosomiasis in our sexual and reproductive health rights packages, right? So, like I said, part of also the symptoms of the clinical manifestations of FGS and urogenital schistosomiasis is infertility, not just in women, but in men as well. But in women, it has been identified. There are research studies that has proven that it has been identified as an underlying cause of ectopic pregnancy, an underlying cause of cervical cancer due to HPV exposure. And so because of this, we are advocating for it to be included in our sexual and reproductive health care packages. It's not just about having the infection. Maybe as a child you were exposed. By the time you get into your adulthood, especially with constant exposure, you begin to see manifestations, because by then you've had a heavy burden of infection. A very heavy burden of infection, so you begin to see manifestation. It's like, say, when one mosquito bites you, just one mosquito bites you, you may not show signs of malaria, right? You may not show signs of malaria. Two mosquito bites you, okay, you may not show signs of malaria. Maybe your immune system is high. You may be able to protect yourself. But imagine with constant exposure, with not protecting yourself with mosquito net, for instance, and every night you're exposed to 3 to 4 bites. Every night you're exposed to 3 to 4 bites since you were 5 years old. By the time you get to 12 or 13, your own case of acute malaria may not even be curable again, especially because you've not even been going for treatment. Now, malaria is a parasite with a high infection. You can high parasitemia, for instance. That's the word for it. But diseases like FGS, especially helminth infections, really helminth infections, you may not automatically see the symptoms until years later. So a child exposed at 10 years, 12 years, 13 years is manifesting symptoms at 17, 18, 19, or 20. Sometimes these infections may remain dormant until you have a sort of immune suppressing illness or immune suppressing situation, and then they come up. So it's important for us to create awareness, teach people about it, so that you can learn to protect yourself, even if you don't want to take government protection.
Thank you so much, Mr. Azugo, for that elaborate explanation. Thank you so much for highlighting that we need to take the drugs we should take, praziquantel and the rest. Thank you for highlighting, especially that it's free, because
Yes.
when it's free, people have increased access to it and people are encouraged to go for it. And I believe with platforms like this, will encourage people and also people get more knowledge on what schistosomiasis is and which drugs are used for schistosomiasis and where they can get them. And if you want to use the drug from that is given free, you can, as you are highlighted, you can go and get it from
Yes.
elsewhere that you are sure that it's a credible source, not a fake drugstore. Also, this is Cancer Awareness Month. Thank you for highlighting that it's also called cervical cancer, and I believe this will encourage people to prevent schistosomiasis as much as they can. In as much as we're talking about cancer, we're also bringing the case of infertility with the increased infertility rate in the globe. And we are seeing that there is a factor that might lead to male, not just females, but also male infertility. Thank you so much for the elaborate explanations and for those points, Mr. Zugo. Basically, what is the significance of deworming in a UGS endemic? Because we know, for example, the Anocha area of Anambra State, UGS is endemic there. What is the significance for residents of Anocha to deworm, or even Nigerians at all? You might want to visit their villages, as you mentioned. What is the significance of deworming?
Deworming helps to reduce the burden of schistosomiasis infections. It helps to not just to cure, because it helps to cure. It expels the adult parasites from the system, because once the adult parasites are in the system, you continue to shed the eggs. So it helps to expel the adult parasites from the system. And it helps to reduce the transmission of infection. When more people are treated and they reduce their contact with water bodies, of course, less people will be infected. The more people are treated, the lesser the infection. It also reduces the transmission. It creates a halt in the parasite's life cycle. When there are no eggs to be released in the water bodies, infection cannot continue. I don't know if you get the point. So
yeah, I get it.
Deworming does a lot, from providing cure to being a tool for prevention, and consequently the elimination and control of schistosomiasis in endemic areas. Of course, it should be important to note that. Thank you. Of course, it should be important to note that deworming alone does not do the trick. It has to be combined with, you discussed as you were introducing yourself, and when I read your profile, you are a One Health advocate. And so it goes to say that it's not just one strategy alone that can help in preventing diseases, especially with diseases like this that has a lot to do with the social, behavioral, and economic aspects of people's lives. You can treat people as often as possible, but would you provide them with food? If you cannot provide them with the food they are going to eat, their daily source of income, you cannot prevent them from going to the water body. Dr. Azeezat.
Yes. I'm absorbing your information. Yes. I'm absorbing your information. Yes.
Yeah, okay, thank you. So, deworming alone is not all we can do. We have to look at different other, and deworming can be very costly. Um, Say, for instance, certain communities in Anambra State are not considered endemic, or I won't say not considered endemic, but are not prioritized for deworming, particularly communities within Anambra Central. And you don't blame the government. It's simple. Deworming is costly. So we have to focus on those communities that are consistently at risk of infections. So communities within the hinterlands are not prioritized as opposed to communities along the riverine. In this case, there is a sort of inequity where some are prioritized over others. That doesn't mean that those communities in the hinterlands are not affected. They are. But what can we do to help them? That's why I keep advocating for education and awareness. If you teach people about the disease, particularly those who may not be able to get access, who may not be prioritized because of their geographical location, if you provide them with education and awareness instead, or along with the deworming campaigns, we can reach a level of completely curbing or eliminating schistosomiasis infection in Nigeria and in the States in particular. So we have to increase awareness, we have to use communication, education to our advantage, and increase access to healthcare. That's what I can say. So deworming is a beautiful initiative. It can sometimes be cost intensive. So combining deworming with other forms of prevention strategies can help in totally eliminating schistosomiasis infections.
Thank you so much for that. Thank you so much for taking us through the management plan. Let me put it that way of using
Yes.
anti-parasitic medication like praziquantel. Ms. Anugo, if you are made the Commissioner for Health today in Anambra State, how will you bridge the gap in treatment plans with regards to UGS?
I think I've overflowed this. Awareness, awareness, awareness. Education, education, education. In fact, at the moment, by the 24th of this month, which is this coming Friday, the first school health club focusing on schistosomiasis that I created in my hometown will be exhibiting all they've learned about schistosomiasis. Thank you very much. They will be exhibiting all they've learned about schistosomiasis. And it's beautiful to see the ripple effect of awareness prior to coming into the schools. These children did not know about schistosomiasis, even though they came from a Sabbatarian seminary school, which means that certain aspects of their prayer and worship require them to go into the river bodies. And many of them who were boarders, members of the community, also go to the water bodies to farm, to fish, to, clean, wash their clothes, farm vegetables and all that. So even I had a student that said they go to the water body for sand dredging. They pack sand into these big lorries that sell off to construction sites and all. So all these things create exposure, but they were not aware of it. But by the time we had our school club activities, which focused on using these students, these children as peer educators, so we teach them to teach others. It was beautiful to observe that not only has their knowledge increased, but you see them also teaching community members. So after a soap making class, I was going home with some of them. Like I said, this is my community. So we had a soap making class over one of the weekends, And as I was going home, I was observing some of the children. They would branch into somebody's house. Oh, did you see what I have? I have a bottle of soap. We learned how to make soap today. And we learned about schistosomiasis. That's how we got to know about this soap making thing. Do you know what is schistosomiasis? And the conversations continue, right? You hear parents stop you along the way. My dear, they say you're teaching schistosomiasis. Please come and explain very well. My daughter tried to explain, but since you're the one, come and explain very well. And even the local health centers are seeing a surge, an increase in people coming in, asking questions, asking to see the drugs and to take the drugs and all that. So I think awareness is important. It gives people agency, control over their health. It's really, really important. But that aside, we need to provide, aside from providing healthcare services, we need to provide basic amenities to so many of our communities. When people have a working borehole, when people have alternative sources of water supply, for some of them, there may be no reason to go to the water body, right? So many of them is for domestic purposes. There is no water. The only source of water is their river, their streams, their spring. But when you provide them with boreholes, when you provide them with alternatives and safe sources of water supplies, it reduces the risk of exposure. It reduces constant contact with water bodies. That's the point of water sanitation and hygiene. Provide alternative water sources, improve sanitation and hygiene, and in terms of improving sanitation and hygiene, we should please stop open defecation. My people, can we try? We've grown to the extent that we should be able to manage certain things properly, provide public toilets. No more seeing men along the roadside just randomly easing themselves. Or little children, mothers in the shop. Mommy, I want to go to toilet. Just go there. Just go there. Into the gutter. And all this with the flood and the rain into our water systems, our rivers and our lakes and everything. And it causes these issues. It increases transmission. So we need to, it's not just about education. Education helps you to know, of course, that these are the areas that you can get infected. But you provide alternative sources of water supply, provide public toilets to prevent open defecation, increase sanitation and hygiene practices, alongside the deworming. All these things combined can help us to reduce schistosomiasis infection. Thank you very much. So you asked if I were the commissioner of Anambra State. Yes, I will first of all include schistosomiasis education and generally NCD education in curriculums, initiate and integrate school health clubs into the systems, into our education systems, so that as part of extracurricular activities, children can learn about these neglected diseases and how to prevent it for themselves. I'll also impute public restrooms and alternative sources of water supply for communities, strategic areas in the communities around the states, and access also to treatments. Ensure that in priority communities like communities in the river banks and the river right areas, there is always access to parasitologist. There is always mass administration of medicines. While in communities in the hinterlands, there is always access to parasitologist, even if there is no mass administration of medicines. You can always go to a primary health care center and knock on the door. Nurse, are you there? Please, I think I have this. Of course, it's free. When was the last time you dewormed? Take information and give them their drugs. So this is what I'm going to do. Thank you very much. And this is what I'm doing.
Thank you so much, Ms. Azugo, for elaborating on that. Actually, what I love most was your initiation about the school clubs for schistosomiasis, which is so much encouraged. And I believe anyone listening to these states which are affected, or areas, regions of Nigeria which are affected by schistosomiasis, and also diaspora audience, people outside Nigeria, if you are from a region that has schistosomiasis, this is encouraged, because this is how we groom current and future global citizens. Like, these children are going to grow and they become the adults. So this is a great way to prevent, by educating and creating awareness. And with platforms like this aiding awareness, I believe we should be able to reduce the morbidity and mortality associated with schistosomiasis. So thank you so much for elaborating on that. And I believe any commissioner for health, if you are close to any commissioner for health in Nigeria and your area is so endemic with schistosomiasis, they should watch this video and listen to Ms. Azugo recommendations on how to help their residents, their people, to reduce the level of schistosomiasis infection. So last question for you, Ms. Azugo. Where do you see Nigeria as a country with regards to UGS management in the next decade?
In a decade, I hope, so sorry. In a decade,
Yes, in a decade.
I hope Nigeria would have reduced, yes, I hope Nigeria would have reduced the prevalence of urogenital schistosomiasis. I hope that the WHO strategy to reduce schistosomiasis by 2030 is elaborate. It covers a lot of these ideas, these prevention strategies that I have listed. And a lot of these strategies are sustainable and scalable. So I hope that Nigeria would learn to start with the grassroots. It's really important. To start with the grassroots because they are the ones who are most affected. To just make policies without considering or involving them may continue to be one of our biggest challenges as to the adoption of some of these strategies within our communities. Co-create with the community members, understand the issues they face, the contextual factors they face. I'm going to give you an example that I think I talked about earlier. In one of our schistosomiasis campaign school club activities, one of the students made mention of, and this to bring it back to the K drama we were talking about, one of the students made mention of something that was very interesting. Because I remember teaching them about the fact that this disease occurs in tropical areas. And while listing tropical areas, I mentioned Asia, of course. And she said something. She said, Ma, so you mean to tell me that if we cannot stop going to the water body, we will continue to be infected? What if we do like these Chinese people do? You see pictures of them. Even when you watch Korean drama, you see them when they are working in their rice farm. They will wear rain boots, they will wear rubber hand gloves, and they will wear sun hats. What if we do that? Because I cannot stop going to the water. It's where we used to wash cassava in the water. So maybe we can do that. If I encourage my mom and she buys rain boots, we can be doing that. And that was actually a very beautiful idea. So maybe we can do that as well. Find ways to co-create with community members. Find ways to co-create with those at the grassroots. Listen to their ideas. Listen to what they need before we begin to implement. Because that is why so many of our strategies have not been adopted. We have to understand what exactly they need. For a community that has no access road and you're talking about building borehole for them, that's not what they need at that moment. If they can have access routes, then the next uptake will be the borehole. Because at the end of the day, what they end up doing is maybe to vandalize the boreholes and use the parts of it to create the breach that they don't have. So we need to understand what the communities need. It's high time we listen to those who are affected, not just sitting in boardrooms. These are very important. Those boardroom meetings are very important, but it's also important to understand what the people need. So I think and I hope that Nigeria will do more of that. Nigeria will focus more at the grassroots and increase awareness, increase sanitation, increase access to treatment at all levels, particularly the community levels. And it's my belief that not even up to a decade, but by 2030, which is 5 years from now, we must have achieved that WHO roadmap for elimination and control.
Thank you so much for that beautiful closure, Miss Anugo. Exactly, that's what in every discussion, that's what to keep highlighting: prevention, 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 collaboration, 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 structure, structure, structure. And I believe if we can have that structure, and I keep saying it in almost every discussion, when the COVID-19 came, it showed, like, it exposed the structure we had on ground. It exposed everything from collaboration to facilities to manpower, it exposed everything. So I believe stakeholder collaboration and collaboration at every level will help us as a country for current and future global citizens, not just even Nigeria. So thank you once again, Ms. Azugo. Global citizens will look at Ms. Azugo's paper during the week on schistosomiasis. If you've never known of schistosomiasis, if you've never heard of it, I believe this is a good start for you to know about it, that it's endemic in Nigeria, for you to know about it, to read about it. The paper is self-explanatory, it's easy to read, it's easy to go through, so please go through the paper and let us have your feedback. When you go through the paper, you watch this video, you have more knowledge, because there is an author's perspective of the paper and there is a publication reader's perspective of the paper, and that's why we put forward platforms like this where research is understanding, so that you understand better what you've read and be able to apply it more, not just for yourself but for our communities. Have a blessed week, everyone.
Thank you so much.